Welcome to Global Health Dialogues. Today, I am joined by a woman whose career embodies the intersection of medicine, politics, and global leadership. Her Excellency Dr. Maggie De Block began her professional life caring for patients as a general practitioner, an experience that shaped her deep understanding of people's vulnerabilities and needs. She carried that empathy into politics, eventually taking on the sensitive portfolio of asylum and migration, and then later on serving as Belgium's Minister of Social Affairs and Public Health. As minister, she led major reforms, from bold tobacco control measures and food labeling initiatives like Nutri-Score, to the groundbreaking Pact for the Future, a structural transformation that accelerated access to innovative medicines. She also worked to streamline clinical trials, strengthen prevention, and modernize the health system. During the COVID-19 pandemic, she was at the center of one of the greatest health crises of our time. And today, she continues her impact globally as chair of the WHO One Health high-level expert panel and as a leading voice on antimicrobial resistance. Your Excellency, Dr. Maggie De Block, it is an honor to welcome you to the Global Health Dialogues.
Thank you very much.
Your Excellency, you went from a medical general practitioner to become a parliamentarian, then to becoming a minister of migration and asylum, then to health minister, and now back again to parliament. Why did you choose this journey? Did you leave medicine to go into parliament? Please explain the reason behind all of that.
Well, when I was a general practitioner, I talked a lot with people too. And when people have problems with their health, they also are struggling with other problems. So I thought there should be a doctor in parliament where they take the decisions. But because healthcare, social protection should always consider first the patient, the man, the woman, child behind it. And so I, in a sort of thought, I presented myself for the elections. And at that moment, they said we have to have more women in politics, but you had to struggle to get a good place on the list. And I got a place that was not really to be elected very fast. But I thought for first round, okay, I can get used to it and I can work myself in. But it was almost a miracle. I was elected. So from my first election, I got into the parliament, but I was still having lots of patients. So I searched another doctor to come to work with me. And then we were two in the practice, and I did the both of them for 11 years. Then I became minister, and when you become minister, you have to let every other job go. So I stopped then, and now there are 3 medical doctors where I used to work. Yeah.
And really, you in a way, you went into parliament. I mean, I'm just trying to summarize what you said, because you felt that there's so much silos, right? The doctors on the one hand and politics on one hand. And we all know that health is political, right? It involves budgets, it involves major decisions. So in a way that pushed you, to go into parliament to make things happen for the sake of the patients.
Yes.
Health is political. How did your years in parliament prepare you for the political negotiations you later had to navigate as a Minister of Health?
Well, I was very active in the Commission of Social Protection, but also health, and also the struggle against poverty, because it's all linked at each other. But I had to do other work also. I had to be the president of the Commission of Infrastructure, but that taught me a lot about So data and connections and search patterns in data. So, of course, you have to do not only what you like to do, but you have certain thing to say, but you do have to have to do on other things too. So I was always very active when after elections there were negotiations. But that was not for the first time. And then suddenly in the evening on a Monday, I got a phone call of our president of the party, and he said, we will have a Secretary of State for the struggle against poverty and asylum and migration, which is a bit linked, of course. And then he said, I was thinking of you. What do you think? And I said, how can I reflect about it? How much time do I have to think about it? And he said 3 minutes, because in 3 minutes I will have to let know the prime minister who will be our ministers in the government. So I didn't have the time to go up to talk to my husband. And I thought I was at that time almost 50 years. So I thought, well, this could be a changing point in my life, in my career. I will take the challenge and I will go for it. So, and I said yes. And then later on, I went up the stairs, and my husband, he said, "Did you know that?" I said, "Yes, for about 10 minutes." So, and he was amazed, but he was always supporting me. So. Yeah,
but he didn't say, couldn't you have checked with me first, or
well,
husbands can be sensitive like that.
I know, but therefore we agreed when we came together. We agreed that we would talk about the family, about family life and things like that. But if it was concerning your own career, that you could do what you thought was best. So
fantastic.
I was a bit covered by an older agreement.
My husband is exactly the same. He was always supportive of whatever I did in my career.
Yes.
And to be honest, if we don't have supportive husbands, we could still do it, but we wouldn't be able to do it well.
Yes.
Because, you need
the
partnership to support each other.
It makes you stronger. I think so too.
Yes.
So you see, we have always been supporting each other, and he had so now I have less to do. So for us, it was a new beginning, being more together, not all evenings away and things like that. So, but we're getting used to it. Yes.
Fantastic. Well, during your term as the Belgian Minister of Social Affairs and Public Health, you took on a very important portfolio.
Yes.
And you worked on the Pact for the Future, which was a major structural reform launched by Your Excellency, designed to modernize the pharmaceutical and health system so that patients could access new innovative medicines faster. Can you please tell us more about that?
Yes.
And, how did it happen? What were the benefits? And I know it can't have been an easy issue to take on.
Well, we wanted change because we knew that working like before, the care could not be strong enough for all growing population. And also, there was too little innovation in medicine to cover new known diseases and treatments and so on. So what we did is we made a strategic collaboration between the Belgian government and the pharmaceutical industry. So I visited all pharma who stayed in Belgium and had production and had research in Belgium. I asked them confidentially for their pipelines for the next 15 years, so to see what is there to come. And then we made a pact. We negotiated a pact. For 6 months we have been negotiating, but then it was really very intensive, but we had really also a multi-year framework financially, because of course they have to be able to keep their personnel and to pay them. And the key goals were that it would be patient-centric innovation, so to get more access for the patients to innovative treatments, support also for research and development, of course, because without research and development you don't have innovation, and to give early access to medicines by becoming a leader in clinical trials. So annually we had over 170,000 patients that could gain access to new treatments. And this is very important. And the return on investment was that we had more people, high-skilled jobs, but also people working in pharma, in export and things like that. So for the government, it was not only a cost; there was a return on investment, and we were very close to what if everything was getting good. So every 2 months there was an evaluation. Every 6 months there was also a financial evaluation, and this made a lot of hours of negotiating and looking at the figures, but it gave us at the other side a stable, predictable, and reliable environment for the pharma industry.
Yeah.
But we always said, what is the important if we have to take decisions? The most important stays the patient, the security of the patient, but also having access to new innovation, to new
and I think that, your leadership, that the fact probably what made it successful, this is for our listeners, this is no mean feat. This is a huge achievement. The fact that you took a very pragmatic view, you certainly went into the meetings not seeing pharma as the enemy, but you insisted on a win-win approach.
Yes.
And you understood without innovation, you're not going to have new drugs. And you understood that pharma also spends to get new innovation. And, you achieved that. But I know it couldn't have been easy. Were there many red faces during meetings, fists on tables? Yes. Tell me more about that, because I'm sure our viewers would love to know. Sometimes, how did that go?
I recall the longest meeting was about 12 hours. So afterwards, we all left the room with a head like that, and feeling very confused. But at the end, when we got the report, then everyone was happy that we went through it. It was the last meeting before having the Pact, and so we thought we were doing something that was unique at that moment, and still is, because now I know that some countries want to do it also, and they're working on it. But until now, we were the only one who did it. So, and I think that's a pity, because, there are so many needs with the patient. And for that, to help them, to help the patient, you have to have a vision, but also you cannot do it alone. So you have to work together.
And I'd really like to ask you, because the Pact for the Future, as you said, you also included a multi-year sustainable budgeting, both for the government and for pharma. I mean, this is every minister's dream. How did you convince the finance ministry to support it? What was the secret?
That's always the difficult part, of course. But, we did it. We convinced not only the finance minister, but also the prime minister. They gave us confidence because we explained, of course. Then you have to go there to explain. And we explained, and they said, yes, It could be something unique and you have put a lot of work in it. So we'll see. But of course, we didn't have 4 years ahead without being under control of finance minister. They were also kept with all. We gave all information also to them from the controls we had and from the meetings we had, of course. Yes.
But you told me, Your Excellency, and I think it'll be very interesting for our listeners to know that, yes, you had some tough times during negotiations, but you said one of the key things was, certainly when things became very tense, you went out for 15 minutes to have a cup of tea or coffee or whatever.
Yes.
And you said the fact that, that people should expect this to take time. And you said it was very important for the teams to be the same people, right?
Yes.
The committees meeting.
That's what we needed.
Yes.
And we also gave time if they had to reflect to their basis. I mean, if there was some decision to be taken and they had to do a little consultancy, they could ask for a little break and go outside to have a phone call and things like that. So,
and it was about building trust, right?
Yes.
The whole exercise. And the fact that the same team remained throughout the 6 months, you kind of got to know each other. You felt aligned with the same goal, which is to offer patients.
And there was also a lot of transparency with the figures and the timelines. And so you have to give confidence to get confidence.
Yes. Yeah. The numbers speak, right? We
Yes.
always say the numbers speak. I don't know if you know, Your Excellency, I'm currently the honorary president of the European Organization for Research and Treatment of Cancer, EORTC. It's right in your neighborhood. It's based in Belgium.
Yes.
And I have seen how clinical trials can sometimes be slowed down by bureaucracy. And I know you worked a lot on that. That was one of your work. But did you work with EORTC as an NGO to streamline approval times for clinical trials while maintaining safety and quality?
Not at that time. We only worked with the biggest research companies and who were also represented by Pharma.be. And also with the generics.
Yes.
We didn't want to let them out of it, but they have little innovation. But the Pact was important for them also to know what was happening.
Yeah. Yes. And I think you told me that also you didn't want to add another mix on the negotiation.
That would have made the
things
number
harder.
of people involved too big, perhaps, and so perhaps not everyone was ready to make it such a big group. Yes.
Yeah. Well, when you talk about making approvals faster for clinical trial, as a mother of a cancer survivor, I'm also very keen to make sure that safety and quality is maintained. So what were the main bureaucratic delays in the ecosystem for approving clinical or innovative medicines? What were they exactly, and how did you try to fix them? Can you give us an example?
Well, of course, it's always you have to have enough data to prove that it would work. And for that, we also searched collaboration with Benelux, so that we had bigger numbers of patients. So the sooner you have your number of patients that you can make your case, the sooner you get along. So that is a delay. Certainly also for rare diseases, we made a collaboration with European, but also further than that, and other European countries. We also had a strong academic industry collaboration between universities and pharma. That is the strength of the Belgium research, that they are working together. And and we also made strategic partnerships with Benelux countries for joint drug negotiations if it were very expensive and rare medicines where we only had, for example, for 5 or 10 patients. And so and then Austria joined us, England joined us, but then they had to leave us because of Brexit. So that was a bit of a problem. But, we certainly had also lots of spin-offs with new really pioneers, not only in medication, but also the MedTech. We also made a pact with MedTech industry. So that helped us a lot to know what was going on in university, in labs, in spin-offs, where were they working on. It was the beginning of 3D printing, I recall. I never seen that they could make a prosthesis just for a child. It was, but children are growing, so then you cannot give a prosthesis for life at a child from 5 years. So it was very for me. I had very much information, and they felt supported. They felt supported because there was so much attention for their work.
Fantastic. And so just to try to put my head together as to what you said. So basically you talked about, for example, one of the bureaucratic delays for orphan drugs would be that they required volume, right? And a small country like Belgium maybe would not have had the numbers. And so by joining other countries, you were able to fix that bureaucratic delay, for example.
And we did joint negotiations.
Yeah, and that's really something, this business of joint negotiations, to be able to bring the price down. It's a win-win for pharma, right? They can guarantee a certain volume of revenue.
For our patients. We did it for the patients because if there are only 5 treatments in Belgium, that will not change much for pharma, but it will change the life of 5 patients and their families.
Exactly. And I know the Pact for the Future, you had 2 countries with you in the beginning, right? You had the Netherlands and who else?
Luxembourg.
And Luxembourg. Is it still alive and active today, the Pact? Have many more countries joined?
Yes. So afterwards, Ireland joined, UK and Austria. But because of Brexit, they had to go out, and the next Austrian government was not so keen anymore. But with the collaboration, Benelux is still working. So not only for that, but also for we joined the agency for control of every ingredient in food, in pharmacy. So we joined also with Luxembourg, and so if it's
Your Excellency, I know that you achieved this model in a high-income country such as Belgium. Do you believe this model can be replicated in even low-income settings where budgets are tighter?
I think so. If we're looking at vaccines, for example, they could join forces also to get more medication to their patients. If they work together, and they negotiate, they could lower the price, they could have higher volumes and higher access. I think it's a model that you have to see what is the situation of the country for the beginning, but you could join, we have joining countries to get further than they should do when they're alone.
Yes, joint purchasing. Yeah.
Yes.
It's a matter of actually just deciding to do it, and you do it, and then people will get on board when they see the benefit. You also took on plain packaging on tobacco. I mean, you really didn't take easy issues when you were a health minister. You didn't take soft issues. You went straight to the jugular. Was the fight against the tobacco industry as difficult as we imagined?
Yes, I didn't want that. So It was very difficult, but it had to be done because the number of smoking young people was going up and up. And we had very much diseases and cancers that were related to smoking, of course. That this is well known, the dangers of tobacco use. And then we had the vapors coming on, the vapors where you inhale a substance that you don't know. We were worried about that, and we also made some legislation for them that should be known what is in it. And I had even a demonstration before my house, before my family house, of vapors because they didn't want to give it legislation that they would not be able to put this or that in it. So that was a bizarre Sunday. I had to leave my house with my children, with my husband. I had to take away my cat because if the cat was going to move, then they could smash a window, and there was all police. So I also warned my neighbors, who were not very amused, of course. So yeah,
That must have been so
not
scary.
so easy to have when they come before your place where you work with a demonstration. Okay, they have the right to demonstrate, but if it is at your home, that is a bit sensible. More sensible, yes.
Must have been so scary, and really it just shows you how the tobacco industry in all its forms, the minute they have any regulation against a deadly product, they will do anything to make sure they don't lose $1 from their pockets at the expense of the population. And really, it took a courageous lady such as yourself to take it on. And I thank you for that. I know in Jordan we are very much still suffering from tobacco power in our country because, as you know, there's so much regulation in Europe and in Canada, Australia, US, etc. So they've been looking into the Middle East and, of course, now thinking of Africa as well. So we haven't been good at fighting the tobacco industry. And I wish we could have somebody as courageous as you to take them on regardless. There
is no way back. And now they cannot smoke in restaurants, in trains, in buses, in planes. I mean, really, so it's going down the number of smokers. Now young people know that's not the way to go. So.
Yeah. Well, it's thanks to, strict and courageous efforts by the government to keep up with the sneaky tactics of the tobacco industry. If you don't do that, they will eat you up and they will own the lungs of our youth and make our population sick population while they are filling up their bank accounts. Unfortunately, I mean, this is what people need to know. They are first and foremost a business. It's all about money. With the best thing
to avoid people to be addicted to tobacco is to see that they don't start smoking. So we also did a lot of sensibilization to younger people, because when you start, it's very difficult to get off tobacco.
Yeah.
And when you don't, I always said, don't start. don't start to smoke.
But unfortunately, the tobacco industry understand that. And that's why they have clear strategies that actually target the youth as soon as, from 10 years old onwards. Because that's their window of opportunity. The minute they make the youth addicted, they are their customer for life. Yes. So so they know that, and we need governments to make sure they don't catch our youth, don't let them to start that first cigarette. And unfortunately now, with the vaping and the e-cigarettes and so on, they have managed to, youth that were starting to not smoke a traditional cigarette, now they're going for that because, again, the tobacco industry made the youth think that it's safer and it's easy to quit. And many countries are now realizing that they shouldn't have opened up the markets for that, because now we have new uptake of youth thinking that this is much safer. And of course, they made it look cooler as well. It looks like a USB. It comes in all kinds of colors. I mean, they are really evil. This is an evil industry that is responsible for 30% of non-communicable diseases. And, they do their bit, and then all the consequences come back to the health ministry to suffer the consequences.
Yeah.
Have you also led attempts to introduce Nutri-Score and stronger food labeling standards? Again, did you succeed in the way you hoped?
And it's still here. So we introduced it and we made the legislation about it. And there we worked together with about every company in food and drink industry. So, and it's still standing. The system is still there, and it's a huge success. But there I was talking in Luxembourg in a European meeting with my French colleague, and I've read about it. Agnès Buzyn, that she introduced a Nutri-Score, and it was research that had been made at a French university. And I asked her, could you send me the references for introducing that Nutri-Score? And she said, yes, I would like you to join us and to do it also. It would be good for neighboring countries because, we have lots of traffic along the border and then so we get the information from her and how she introduced it. And then we also introduced it and it was, industry was at first, they wanted to see what was happening. They asked their colleagues in France and things like that, but they took the challenge of making healthier food for children, for everyone, so that you know what you eat. Of course, we had people also who were not so happy, like, for example, the Italians. They sent me their ambassador because they were worried about their cheeses and I said, you can keep your what you are exporting, but you will have to see at the doses that you sell. So the Parmigiani, you can take a bit, but you don't have to exaggerate and don't eat it every day. They were not happy, but I think at the end they didn't suffer about that. So and I give the example that in Belgium we have lots of production of chocolate. Belgian chocolate is very low. I said, I'm not going to say you cannot eat chocolate, but you just have to know that there is lots of sugar in it, and that you will be you have to eat one praline and not an whole box.
Yes, which is super difficult, right?
Yes.
I mean, I'm one of those.
It's better not to have it at home.
Yes, I'm one of those. If I buy candy, I love candy. It's terrible. I know it's terrible, but I won't let it into the house. And if I do let it into the house, I ask them to hide it from me. Yeah. And then I go begging, please, where is it? Where is it? And then, so it's better not to have it at all. But I mean, going up against the powerful food industry also, I mean, that can't have been easy. How did you succeed?
But
you make it sound so easy, but surely you had resistance in the beginning.
Yes, but when we explained, it leaves the patient has a choice, they can choose for an A, a B, a C, D, but they have to know that at the end it has to be more healthier and so on. So, and for example, for children, they were very inventive in helping us. They introduced little fruit and vegetable snacks, little carrots, little tomatoes, and now I see for my grandchildren, who go to school and are about 5.5 and 4, they don't only take their sandwiches with me, but also a box with fruits, little box with vegetables. So they are really, from the beginning, they know we don't only have to eat our sandwiches, but we also have fruit and we also have vegetables. They take cucumber with them, tomatoes,
Yes.
melon.
This sort of, well, we're lucky here in Jordan, although fast food industry has also taken hold.
Yes.
But in general, Arabic cuisine, if I may say so, it's one of the best in the world because we really have so much fruits and vegetables and salads.
Yes.
And, when I was young, you could say, we were eating, we ate everything green. Nobody had to, parents never had to convince us to eat any of those because that was our cuisine. Tabbouleh, you've heard about tabbouleh.
Yes.
Salads. For us, salads is not like a special thing. It was always there. So when I went to study in England, they said, "Oh, are you having a salad?" I said, "What do you mean? We always have salad. It's never the main dish. It's always there." So we're lucky in that, but also, but fast food has definitely taken hold, and you do see more obesity in the young generation,
Yes.
as is globally, unfortunately. And then I want to talk about a very important issue that's really not taking on the urgent, spotlight it should take, which is, and you are a leading voice on that. You're a leading voice on antimicrobial resistance, and you chair WHO's One Health Advisory Group. And in short, they call it AMR. And for our listeners, AMR is not getting the attention it deserves. Basically, resistance to antibiotics is really an extremely scary issue. That once overused antibiotics stop working, and we all know that we've been overusing antibiotics for so long, and once they stopped working, the entire health system collapses. Why? Because for decades, antibiotics have held the line between life and death. They made surgery safe, chemotherapy possible. They turned once fatal infections into simple treatments. And you told me the terrifying truth is that there is no plan B. Pharma is not making new antibiotics. Can you please explain to us why there is no plan B? Why is that so?
Well, the difficulty for the moment is that all possible variations of antibiotics have been used. So the the last new one that came to the market was the quinolones, which were a special group, and they were meant to treat only as a last possibility very difficult infections of kidneys and lower lung infections. And then there were too many prescriptions made for patients just for an infection on the ear or for So, and that gave us a quick growing antibiotic resistance. So then we also had to take measures. What we did already was working together with agriculture and people with elevating animals for consumption, because you have to look at it a bit holistic as a one health threat. It's not only the use in humans, but you can get a resistance by eating treated meat, fish, and also fruit, all the rest. So then, without knowing it, even if you eat healthy, you still can have an antimicrobial resistance. And we know that lots of people are dying of it in our hospitals where there is no treatment possible. And so it's all over the world, of course. And that's why also, for example, in England, Dame Sally Davis is really a dedication for her to work on it. And we often see each other, and then we have meetings, and then we know that it's also a danger in other continents, and we have to work there. But pharma is looking for new, but when I lost information I had, that there were only 4 possibilities that were now in the pipeline, but 4 possibilities gives not yet the insurance that there will be one at the end. So we have to make the other decisions and be very, very carefully by giving antibiotics at children, at people, and certainly to see also in hospitals that there is not too much use of it. Yes.
But as I understand it, Your Excellency, correct me if I'm wrong. So basically, in the past, people were using a lot of antibiotics. Certainly, in my childhood and my children's childhood, my goodness, we were given antibiotics left, right, and center. And now I see with my 2 grandchildren, the doctors now are very, very careful. They keep saying, no need, you have to wait. This is a virus, no need to cover with an antibiotic, and so on. But the reason, what I understood, is that the nowadays, because it shifted, pharma are told we want antibiotics, but we want their use to be restricted. So this means the economic model for antibiotics is broken because, they think, why should we, they're expensive to develop new ones. And if we develop one and the governments rightly restrict their use, so the return on the investment is low. And I heard somewhere, or I looked into the research, now they work on something called the Netflix model or the delinkage model, which basically to incentivize pharma to develop new ones, whereby, or even to supply the ones that we know, simply whereby the model separates the developer's revenue from the volume of antibiotics sold. In other words, pharma would get paid even if the antibiotic is not used often. Because they've realized if we don't incentivize pharma, we're not going to have our plan B. And the value of new antibiotic is not in selling millions of pills, but in having it available when a deadly superbug appears. And fact, this is the opposite of the traditional market, where companies only make money if they sell large volume.
Yes.
And, can you tell us more about that?
Yes. Well, you have to do both of the measures. You have to decrease the number of antibiotics that are now prescribed, and certainly starting to give them to children, to babies. Then we see that they very fast have a big resilience against antibiotics. So you have to do both. You have to keep your restrictions in prescription and use, not only human but also cattle and crops, but and fish. But you have to convince them that there has to be a plan B. So they have to invest in making a plan B, knowing that, yes, it will be for a very restricted public, only as the last resort, so to help people. But we need that. But it should be restricted. Otherwise, in a couple of years, we are back where we are now, that we have no plan B. So it's difficult to understand.
This is a very important issue, and honestly, it deserves to have more spotlight on it.
Yes.
When you go in deeply into the research, you realize how scary it is and how much our health system actually depends on antibiotics for us to do all of that we do.
Well, we have seen with COVID also that then we, of course, there were very ill patients, but we used a lot of antibiotics.
Yes.
So sometimes people now who survived but have, long COVID, then also for them, if they get an infection, it will be very hard to find something to help them. Yeah.
You mentioned COVID-19. it was a shock to all of us. And certainly the pandemic was a difficult moment for you as a leader, found yourself in the midst of it. What the benefit of hindsight? What do you feel Belgium and you personally got right? And what would you approach differently if you faced with another global health emergency?
Well, there has been a report 3 years after, because from ACDC, where they looked at about more than 30 countries, how they coped with it, and how many people suffered, how many people died, what were the measures that were taking. And this that we were very, we managed it like other countries. In the beginning, we were surprised and we didn't know how to. We had to find everything out. And that was that, but then pretty quickly, but we took measures that had consequences for people's health, like the isolation, families not being able to see each other in different generations, that, children not, like in some countries, children not allowed to leave the apartment or the place, so not be able to play, not to be able to go to school. People got mad. I mean, I know that there is lots of tension, but at the end we took the right measures by protecting our people against the virus, which we didn't know for first what it was. It was a sort of corona, as the flu was very often corona, but it came from China. We didn't have the information. The Chinese said, "Oh, nothing's happening." Other countries said, "Oh, it's not in our country. You can come to ski, you can come to vacation." So lots of people got infected, but what we still don't know is why some people get so sick and others don't have symptoms. And that was the danger of children were infected, but they didn't have symptoms. And they infected their grandparents, and then the grandparents were very sick or died.
Yes.
It was dramatic for families and for friends, and so many people we had died in elderly homes. Of course, there were afterwards we saw that the average number of people dying, it was a peak and then less. But still, it was shocking for the family not to be able to be there together at the funeral. So at a certain moment, we had 12 persons to get a grandmother of the funeral. So it was, for some people, it was very hard also to take all this information into change of their lives and the loss of their families. So at the end, but we have, of course, also lessons learned if there is ever another pandemic. But it could be another, because, when I started, I had Ebola, but it is a very different infection. It's by fluids, it's by touching each other. So this was a respiratory virus. So that was another, I think everywhere ministers and governments had a big struggle and fight. And there was in Europe not enough cooperation. France closed their roads for transport of medication to us, to Netherlands, to Scandinavia. I mean, really, it's the collaboration in Europe. It was when you had to do it for yourself, for your country, and
everyone went on their own, right?
Yes.
And has Belgium now taken measures to make sure that they are more fully equipped to deal with the next pandemic?
We used to store our protective material in firms and in storages in France and in Germany. Now we have our own national supply, and in Belgium. So whenever there would be something like that, they cannot isolate us anymore.
Yes. But it is such, I know that every country went on for its own self-interest, which was really a shame. But, you would think European Union, you have so much collaboration, you're a union, and yet at this time, there wasn't the same collaboration that one would have hoped for.
Yes.
And
we had very much meetings, and everyone said we have to work together. And then when they went, they didn't do it. Really, yes. That was a disappointment, but you get to get over it and say, how can we avoid that?
Yeah. And were you one of those health ministers who appeared every day on TV at a certain hour to explain to the people what's happening?
That was another thing. We started very, very early in the morning, about 7 o'clock, seeing what is the situation in hospitals, in elderly homes. And then at noon there was already an invasion of cameras in the cabinet, so coming to interview you for the news. And in the evening there were all the programs, also on television or radio, where there were debates and things like that. At a certain moment, I came into a studio, and they said, "You have to." There is no one is going to get you some powder, not to blink too much at the screen because they're all sick. And I thought, well, being here together in the studio with everyone, there were no vaccines yet, is not really a good thing. We come all from our community. We're talking to each other. So the air is being blown into our faces. And so at a certain moment, I created a sort of room in my house and at the cabinet where I could have online discussions and things like that to avoid me and my people. I had about 100 people working and meeting with us. Of course, we took measures, but I said, this cannot happen that we are getting everyone sick here, So.
Yes, but communication was so key.
Yes.
I remember
but
we would wait for our health minister to talk to us. Yeah.
Yes, but I asked for the help also of our, we had a scientific board, to see what's happening and what has to be done. And in the beginning, every day they had 3 moments of communication.
Fantastic.
To the people.
Yes.
And they did it until the end, but then it was once a day. Then it became twice a week. That were people from the scientific administrations that really did more than they should have done for concerning their job.
It's often been said it's very different when you are a normal citizen thinking, the health ministry should do this or that, should solve this issue. But it's a very difficult story when you sit on that chair as health minister, because suddenly you have so many other priorities to think of. Were there any difficult trade-offs you had to make? That you wanted to do and solve certain issues, but you couldn't because there were so many other priorities?
Well, we tried to work very hard on the COVID consequences, but we also needed to have continuation in the rest of our policy. So we tried to do both of them. And it demanded a lot of my people working for me, but there was such a big solidarity that they gave their life for it. Really. So I think it was a difficult period, but it also was something that if there had not been COVID, I never would have known that we could do so much work.
Wow. Yeah, amazing. Everybody stepped up. What advice can you give for people on how to advocate for health in the political arena, from your experience being in both?
I think there should be more people standing up for the health issues, because health is not for everyone the same. It depends on where you're born, how is the condition of your parents, grandparents, what is already in you, in your DNA. I mean, when you have more possibilities to keep your health or to get sick, so that is so different. So everyone should be knowing that health is not gained for life. So some things are unexplainable, but touches younger people and children, for example. And there is so much research still to do, and so much to learn. Now we have other possibilities. We have other possibilities of analysis. I think this is very promising, that we can see the patterns in DNA, the family trees they can make, so to see where in which generation someone was touched. I think it should be a concern of everyone every day. But that is a bit of dreaming. And
But since you are now you're still active in Parliament and of course in global health, what would you expect from people who want to advocate for health in Parliament? Is it by keep connecting with the health committee, giving them data, nagging? What is it that you feel works? Because many people don't know how to do that.
I still have contacts with people I work with in Parliament and also international, but I decided not to stay in Parliament anymore. So I didn't want to be re-elected. After 25 years, where I was 10 years a minister, almost 10 years, I thought I should give the opportunity to younger people to go there. And I have my basis, I have my relations, I can work on my own, I can cooperate. So it gives me more time for my family, but also to choose what I do. I said from this moment, I will do whatever I like to do. I want to do.
Yeah, this is our chapter.
Yes.
We're both grandmothers, you and I.
Yes.
You have two and I have two.
Yes.
And I certainly feel this way, Your Excellency. I feel like I want to do what I want to do now.
Yes.
In my own terms. But I heard that you'd love to do more travel and that Jordan is on your bucket list.
Yes, I've never been to Jordan.
You have to come. And I'm here. I would love to show you around, and you can see Petra, the Dead Sea, and all the wonderful archaeological sites that we have here in Jordan. You have to come. Don't keep it too late. You just have to book it. Make the decision and go.
We certainly want to travel more and be more with the family, go to the sea with the grandchildren. We did this year, so 14 days of very healthy camp.
Fantastic.
But that gives you so much satisfaction also. And when you are still involved, like in Parliament, I mean, you have the nights, you have to have reunions, you have the holidays, days like Christmas. Sometimes you're still in Parliament. And now, for example, they are still discussing the budget. So normally Parliament should meet in the Christmas holidays. I've been there. I've seen that. I hate it because now I want to be with my grandchildren.
Yes, totally agree. And you've paid your dues. For sure you did. Well, thank you so much, Your Excellency.
It was
for
very
a
nice
wonderful podcast, I have to say. And I'm sure your listeners, our listeners, enjoyed your insights and perspectives. And I hope to see you in Jordan one day. Don't leave it too late. And thank you again for coming on my podcast.
I liked it very much, and I wish you all the luck.
Thank you so much. Thank you so much, Your Excellency.